Where are we at on time?
Time.
12:02. Okay. What that means, I'm running late. So let's get this show on the road. Welcome, welcome, welcome. It is March 2nd, already the third month of the year. Can you believe that?
Yep.
And we'll ring in the meeting. Wow, that was loud. Is that loud for everybody or just me?
It was loud.
Okay. Excellent. All right. So our invocation is going to be Ron Smith.
Well, thank you, President Andrew, and greetings, fellow Rotarians and our honored guest. You know, at a regular meeting, we're sitting before a meal and our invocation takes the form, one form of saying grace. And I started looking around on the internet about that, and there's actually a book about saying grace, at least one anyway. It's called 100 Graces, and it was written by Marcia M. Kelly in 1992. And this is part of, yeah, interesting. And it's really cool. It's all done in calligraphy and everything. It's worth looking at. I think you can buy it for $5 or $6. Anyway, this is what it says about grace. So saying grace is an ancient and vital tradition the world over. To begin with, it provides a space, a moment of stillness in which to relinquish the activities of the day and allow the mind to settle. Then, as we acknowledge the source of our nourishment, we are filled with an astonishment at the generosity of our Creator, with gratitude and with praise. And bringing the body, mind, and heart together, we come to know ourselves and remember who we are and why we are here. For some families, a meal is the only time everyone is present, and so the opportunity to enjoy one another and really celebrate the occasion is not to be lost. For many, a meal is also the only time that there is any memory of the divine. Saying grace establishes an immediate connection with that memory. About to sneeze. In such a moment when our minds are clear and the truth is reinforced by being sounded aloud, we can dedicate the meal and the strength we receive from it to the service of whomever or whatever is before us. And so that takes me to the actual prayer, which is offered by Mother Teresa. And among her many, many accomplishments, of course, was her Nobel Peace Prize awarded in 1979. And she said simply, "The fruit of silence is prayer. The fruit of prayer is faith. The fruit of faith is love. The fruit of love is service. The fruit of service is peace." And out of respect for all of you that are hoping to have some peace, this invocation is over.
Thank you. That was very, very wonderful. Thank you. All right. Let's go back to the screen. And I believe we have Christine Montan up for the Pledge of Allegiance. And you have to unmute. There you go.
I got it. Please join me as we salute the flag of our great nation. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Excellent. Thank you so much, Christine.
Sure.
And here is our patriotic song for the day. It's a little edited, so because it was 7 minutes long. I hope it edited well. Let's see.
This land is your land, this land is my land, from California to the New York Island, from the Redwood Forest to the Gulf Stream waters. This land was made for you and me. As I was walking that ribbon of highway, I saw above me that endless skyway. I saw below me that golden valley. This land was made for you and me. I've roamed and rambled, and I followed my footsteps to the sparkling sands of her diamond deserts, and all around me a voice was sounding. This land was made for you and me. This land is your land, this land is my land. From California to the New York Island, from the redwood forest to the Gulf Stream waters. This land was made for you and me. When the sun came shining and I was strolling, and the wheat fields waving, and the dust clouds rolling, and the fog was lifting, a voice was chanting. This land was made for you and me. This land is your land, this land is my land. From California to the New York Island, from the redwood forest to the Gulf Stream waters. This land was made for you and me. This land is your land, this land is my land. From California to the New York Island, from the redwood forest to the Gulf Stream waters. This land was made for you and me. This land was made for you and me.
Righty. Going to go a little out of order with our programming today. Before we do howdy, we have a quick update on Sampus Academy from Keith Rickenbacker.
Thank you, President Andrew. After our meeting last week, I learned that there was a planned closing of Sampus Academy, and I wanted to give you a brief update. I did learn after that meeting that there was a closing schedule that called for starting to remove students pretty much immediately for the next several months, with the closing date for October 1st. But while we were meeting last week, there was another meeting going on somewhere with a lot of powers that be, and they stayed that time schedule for 9 months. So the school is safe for the next 9 months, and there will be a lot more discussion about that. Regular and I'm sure lengthy meetings, a lot of different places. I've also been asked a lot in the last week, what can I do? And if you can go back to that one slide, change.org, Andrew. No?
Yes, sir.
I've got something different here. No? People are asking, what can I do? There's a very simple thing you could do. There is a petition out there that was started and written by a student at Sampus Academy. You can just Google Sampus Academy petition, and it'll come up. You'll find it right away. Or you can go to change.org and just put in Sampus Academy. All you need to do is put in your name, your email address, phone number, and click sign the petition. They had a goal of 5,000 people to sign that petition. Started on the 25th, last Friday, I think that was, or Thursday. They hit 5,000 almost immediately. They bumped the goal to 7,500. They passed 7,500 this morning, and now marching towards 10,000. So there's a lot of people that support Sampus Academy, and a lot of noise being made with our county supervisors, Sacramento, and a lot of different places to keep the school open. So if you'd like to do something, go to change.org. I'll keep you posted on progress. Thank you, President Andrew.
Thank you, Keith, for your work on this. This is important, and I appreciate the time you're putting into it, because I know it's a lot.
It's exceptionally important, and need to think of the kids and the house parents, grandparents, staff, everyone else out there. It's an amazing place.
It is. All right, so let's move on real quick. Not that we have to, but well, we do have to, because we have to get done with the day. Welcome to our meeting, March 2nd. Just give me one hug. That's all I want is a hug, right? Let's see. We have our speaker today as a guest who will be introduced a little later. Paul, welcome. Do we have any other guests? There's one name here I don't recognize. I mean, I don't know who it is. It says iPhone DX4DP16. I have no idea who that is. If you can give me a chat with who you are, we can get you signed in. If not, then we'll assume you're a guest and say, hey, welcome. Any other guests or visiting Rotarians? Hearing none. Paul, we have a special treat for you. We're not going to sing. That's the treat, because the last time you were here and we sang, I think you almost didn't come back. But we do have this.
Howdy, we're glad to have you here. Welcome, we sing it loud and clear. Relax, enjoy the program, and won't you come back to see us again?
Thank you, Aussie, for recording that for us and preventing us from doing a Zoom sing-along. All right, our upcoming calendar. We have Haven House tomorrow night. Kelly is in the crowd today. I think, Kelly, are you still looking for help in April, or have you filled all your spots up? I put her on the spot.
I have filled my spots through June, so I'm good until starting of July.
All right, perfect. Perfect. It's a great program, and I encourage anyone who can to do it. I intend to be rejoining that after June myself. Next week, we have the East Valley Specific Plan. On the 16th, functional learning to speak right now. Functional medicine specialty from Dr. Sabiha Pasha. On the 20th is the Veteran Stand Down Clothing Drive. On the 23rd, we have Robin Douglas joining us again. The 30th, our district governor, Steve Weitzen, will be speaking to us. On April 6th, Blake Steinecke. I'm still tired, folks. I'm sorry. On the 10th, District Training Assembly. It's a great thing. I don't know if they've put pricing out yet. It'll be virtual. This is a great way to get to know what the district does and how we fit within the district and what you can do to promote our club. And I would encourage everybody, especially since it's going to be virtual, to sign up for the District Training Assembly on April 10th. The 13th, we have Second Serve. And on the 20th, we'll have the first of 2 presentations of our community grant recipients from our amazing community service director, Alex. All right, member moments. We do have one member moment, and actually, Bernie, this is yours. Do you want to speak to it? Bernie, Blaney?
Oh, I'm sorry. What?
I had put the email that you sent and about the memorial.
Oh, thank you. So this Saturday, my daughter has organized a Zoom memorial celebration of life for Vern. And if any of you would like to join, you're very welcome to. And my daughter Tracy will be here with her fiance Mike and one of the 25-year-old twins. Simone will be here with me, and they'll be running it, and they'll start opening up on at 1:45 to let people in. And it sounds like she has a very nice program planned. So I would be happy if any of you would like to join in.
And if any of you did not get the email, let me know, and I will get you the click here information and all that. So just email me. You can find me in the directory, or it's akerwin@cox.net. And I will get this to you, so you just can click or have all the information instead of having to jot it down. Thank you, Bernie, for doing this and for inviting us. It's an honor, truly.
Thank you all for everything.
And as difficult as the transition always is, we go from sad to light. A couple of weeks ago, I got this picture from In the Wild. This is kind of a throwback to a couple of years ago. It looks like Ron Smith took Royce Moore out on a boat. He never came back. We're not quite sure what happened, but at least we have this last picture of Royce and Ron together. And speaking of wanting to make friends, here is Mike Freet out trying to find somebody who will actually like him.
Huh.
And Aussie's been studying this week.
That's cute.
This was all thrown together at the last minute. I apologize.
Good.
Again, I've just been a little tired. Ron, would you like to talk about the Son of Desk building?
Oh, I would love to. Thank you. We had a great day on Saturday. Our goal was to build 50 desks. We had a great team of volunteers help us get everything ready. On actual build day, we had Rotarians from 3 different clubs, which I greatly appreciated. We have had some folks from Thursday, the Sunrise Club. We had folks from 5 and a whole host of Escondido Rotarians and just friends of different people who wanted to help out. I said our goal was to make 50, and we actually ended up finishing 50 desks by about 2:15, which was close to 2 hours sooner than I thought we would. It was an amazing effort. These folks worked so hard, and the school district is getting delivery of the desks today at 1 o'clock, which is why I'll be leaving the meeting a tad early.
Oh, see how you are? Thank you, Ron.
It was a lot of fun. We really appreciate the board having faith in our project and helping us to find another pot of money. But the real credit has to go to club members who have stayed with the club and have provided funding. And we're just hoping that we can keep all this stuff in mind, because pretty soon we're going to be looking at how to raise money for next year's projects without having a face-to-face tour. And I know the board has some really good ideas on it. If our club members will support us in the way that the ask will be shaped, we'll have a fantastic Rotary year next year as well. Thank you.
Excellent. Good point. Thank you, Ron. And thank you for all the energy that you put into this as well. Oh, Marilyn.
Yes.
It is birthday time.
I know. Where is the year gone?
Right?
I can't believe it's already March. But this month we have Dave Plattner on the 4th, Roberta Ramirez on the 5th, Charlotte Hotchkiss on the 10th, Myrna North on the 12th, Earl Dowdy on the 20th, Doug Moyer on the 22nd, Ken Hugans the 26th, and Mike Peters the 26th, Mark Miller the 27th, and Wendy Schaefer the 30th. Happy birthday to all of you.
Yes.
And I think we'll preclude the singing unless somebody else would like to sing.
Jay, you want to sing? We could do the birthday song in Home on the Range.
Sure.
No, I don't think so.
Oh, darn it. All right. Well, since Doug Moyer, oh, look, Mike is an angel now. Since Doug Moyer is here, would you like to blow out the candles, Doug?
Sure. Okay, ready?
1, 2, 3.
Good job.
Big breath.
And the wind just came up.
Yes.
All right. Let me mute everybody except, and Jay, you'll have to unmute.
Okay.
And we now have our fun song for Dr. Hegyi.
Okay, here we go. If you need to know about this CEO, then you've come to the right place. He'll talk with sobriety about the society that's in charge of our medical space. Paul Hegyi is here. He says you don't have to fear. His name rhymes with wedgie, but don't get too edgy. He just wants to bend your ear. Ta-da.
Woohoo! That was not Thank God I'm a Country Boy, but it sounded good anyhow. All right. Dr. Moyer, would you like to introduce our fantastic speaker for the day?
Yes, sir. President Andy, fellow Rotarians,
gives me great pleasure to once again welcome back Paul Hegyi for his now annual update on what we can expect in 2021 in healthcare. Paul was born in Brooklyn, but he had the good sense to move to California as a youth, grew up in Sacramento, educated with a BA in government at Cal State Sacramento, MBA with honors at USC, for which I guess he can be forgiven. Previously employed for several years with the California Medical Association, in which Paul wore many hats and fulfilled a variety of roles. During that time, they experienced a greater than 15% membership growth. And when Paul left the organization, it had its highest membership that it had up to that time. County Medical, then Paul came to San Diego, and we've been blessed with his presence. County Medical Society has over 4,500 members, both physicians and medical students. Paul's likewise active in many organizations with the common goals of improving community health and healthcare access. He additionally, in all his spare time, he teaches a business and medicine course with some physicians at the UCSD School of Physician. And thank you once again for joining us, Paul.
Thank you. Thank you for having me again. I'm going to try to share my screen as well. Let's see if I can get this going. Hey, there we go. Well, I've got to say, I'm really impressed. You guys got this Zoom meeting dialed in. All the preamble stuff that I'm accustomed to is there in there. And I was afraid I wasn't going to get my song, and sadly, I did not have recording going on that. My staff is very much looking forward to that. So I will tell them yet again.
I'll send you a copy.
Please, you can imagine I got the wedgie reference many times growing up. So I'm booked for 3 hours. I have on this, right?
Yes, absolutely. You have 35 minutes in 3 hours.
Hopefully, I should be able to get through that fast and hopefully get some questions. You can help me. Maybe if people raise hands, you can grab my attention. I'm happy to take questions as we go through. Obviously, at the end of it, with the Zoom, it'll be easier. Hopefully, I'm good at this. I know at the beginning of COVID, it was a challenge juggling some of these things, and I just got a message came through too, I think. But I'm getting kind of used to these. One of your Rotarians was just calling me, or former Rotarian, Dr. Nick Infantidis, just tried to give me a call. So I don't know if his ears are burning or if he's listening in on somebody's line here. Let's see, he's texting. I'm gonna see. No, on your, give me 1 second. Hopefully he'll understand that. Okay. In the past, I've talked to you and it said, looking forward in healthcare, what's going on this year. I've highlighted why healthcare is an important issue, the growing percent of federal budget over the decades. I've talked about the growing part of healthcare as a cost of our society. Both you can see on the left, percentages in Medicare growing dramatically over the decades looking forward, but also to businesses and personal budgets. Many of you run your own businesses, you deal with payroll issues, or you sell insurance and see those skyrocketing costs. I've talked about where that money goes, but who has insurance and who pays it. These are the slides from last year. The data, I didn't double check the data, and you'll see why. Last year specifically, I highlighted the presidential election and different healthcare plans. I've deleted all those other slides, and here were the things that now President Joe Biden highlighted. Of the leading Democratic candidates, his was the least negatively impactful, least costful to the federal budget, but it includes a public option, expanding the Affordable Care Act, tax and capital gains and up. All of that's kind of in abeyance. We haven't seen a major package yet. Obviously, he just got in office, and there's this little global pandemic happening right now. And so, you mentioned quite a bit at the beginning about, I can't believe it's March already. I feel like it is still March. We are in the 367th day of March as far as it feels to me. You know, the world beforehand, people were partying in the streets and going on vacations and hanging out at the beach. And we used to think of Corona just as a beer that you might serve with a lime. And now it all has a very, very different meaning to us. So as you can imagine, and hopefully are not that surprised, I'm going to talk a lot about COVID today, because COVID is what I do almost 100% of the time. 95% of my time in the last year has been focused on COVID. So I'm hoping to go through some of the data, talk about vaccinations, some of the stuff that I know about reopening, and then answer your questions. And for context on this, I mean, I spend dozens of hours every week in briefings, following the news, talking with physicians across the board, infectious disease specialists, county officers, state officers, my own physician leadership, and many, many others about what's going on in COVID. And so I have a pretty good feel, pretty good expertise on the impacts that we're having, where the data's at, and the rest of it. So hopefully I can answer some of your questions, and if not, we can hopefully follow up. Data, newest numbers from the state of California. This is a comprehensive snapshot over the course of just over a year now. The first cases in San Diego came in the middle of February. We've been shut down since March 19th, I think. It's been a state of emergency in the state. 3.5 million people have been diagnosed with COVID this year. 52,000 deaths in the state. Huge cost in people to our community across the board. Update from the governor yesterday, though, and you've seen this in the news, and I think you've seen this in the community. Things are going much better now. We had this huge spike that really started after Halloween. You're probably familiar with the stories. At exposure, it's about 2 weeks to onset of symptoms. And so at about 2 to 3 weeks, our hospital population started going up. I started getting calls. I mean, there was a day there in November where we had literally 0 ambulances available in the county. Every ambulance had bodies in it and were waiting in parking lots at hospitals to unload that were over full in their emergency rooms, and they were averaging 6-hour wait times. The military generously helped and supplied some staffed ambulances to help offset that load, and so we were able to take care of that. Fire trucks were literally transporting patients to hospitals, which is not normal. That got settled. The hospitals learned to adjust. They opened up their main lobbies and their gift shops to triage patients and get them in. But it got worse and worse through Thanksgiving and Christmas. And really, a lot of the science shows it's being indoors, mixing with people that you haven't spent time with. And obviously, family time gathering in the holidays is common, led to big growth rates. That is all dissipated as we expected after we passed Christmas and those infections. They've been coming down dramatically. And more than just that, I think there's other good reasons to expect that to continue to improve. Here's your vaccination rates in San Diego. And this is something I think we all should be incredibly proud of. As of this morning, over 21% of San Diego adults have got at least 1 dose of the vaccine. Over 10% have 2 doses. For comparison, the statewide number is 16% and under 7% for the 2 doses. So San Diego is head and shoulders above the rest of our state in getting vaccines out. We started slow. I was very frustrated in late December and January with the planning and the logistics. but I'm incredibly impressed. First, UC San Diego stepped up and offered to put together what they call a vaccine superstation, a max vaccination site that was settled in partnership with the county at Petco in the parking lot next to Petco Park downtown. Since then, max vaccination sites have been open all over the county. There's at least 5, and many smaller vaccination sites that are doing 200 to 500 people a day are throughout the county. And that has really ramped up and let us go from being in the middle of the bottom of the state in delivering vaccines and getting people covered to jumping ahead of everybody else. And that number is obviously critical because that's going to lead to the herd immunity that we want to see in our community. The more people that are protected, and that includes the people who've already been sick. A lot of them are in our community and not getting sick again, and starts to build up that herd immunity that we can get to. The county's plan is to hit this number, to hit 70% of eligible adults by July 1st, and they're well on the way for that. The biggest holdback has been, and this number would be higher, has been vaccination supply, getting access to supply. We were steadily getting access and keeping ahead of it. We could use more, but we were keeping up production until the ice and snowstorms, the cold front across much of the country, stalled vaccines for about 10 days or so. But all of that's picked back up now. As you see, we've got over 1,000 doses in hand, and that is continuing. Here's some details on the county's rollout and plans, and you can see these different things. So we started with 1 superstation. As of last week, there's 6 sites around the county. I know Del Mar's got 1. San Marcos is a superstation nearby all of you. There is South Bay was the 2nd superstation. An old Sears building. Grossmont has a superstation as well. I guess I can't figure out where the 6th is offhand. I heard Escondido was getting it. It might actually be Escondido. It might be at Palomar, but I'm not certain of that. But as you see, we were doing 14,000 a week last week. We could do 33,000 a week. And a lot of that was because of that supply issue that we had from those ice storms. Hopefully we'll be picking that up here very quickly. There's a lot of questions about the vaccine and comfort and safety of the vaccine, side effects, and the rest of it. The breaking news over the weekend is that the Johnson & Johnson, the 3rd vaccine, was approved here in America. We've had Pfizer and Moderna since December. I myself have been vaccinated with the Moderna vaccine. I've had both doses. So I can tell you from personal experience, I feel comfortable with it. Our charity has been doing vaccinating. I've been volunteering at some of the vaccine sites, and so I was able to get the vaccine. And so I'll give you a little of my personal experience. Well, I'll tell you directly. I had very, very light side effects. I think less than average. The first vaccine, I didn't even have a sore arm. I didn't have really impact at all the first dose. My coworker Jen, who is number 2 at the Med Society, she had a pretty severely sore arm after that first dose. Like, she was having trouble with it the next day, but it dissipated after that. The second dose, the news is, and the data shows, is much more severe side effects. But these are natural, and frankly, they're good. I've heard a lot of reports of fever, body aches, sweating. They hit it about 12 hours after the vaccination, and they tend to go for about 24 hours from that point. I didn't have much of that. I was probably a little lethargy, a little tired the next day more than normal, and that's very common. But otherwise, much better than the fear of getting this virus and ending up in the hospital or something like that. The Johnson & Johnson vaccine just came on, and that has a great opportunity to make huge benefits and inroads. First off, it only requires 1 dose. This is critically important, particularly for our communities, our underserved communities with higher illness, particularly thinking of poor areas, ethnic areas where our homeless populations, where it's hard to get people, it's hard to get them scheduled for a follow-up appointment on a regular 3 or 4 week period. If we can get one dose in and get those people covered, I'm getting some feedback. Can we use that?
You don't have to pay anything, it's already there.
Oh, there it is. I found it.
On
I was
there.
looking for it.
Thank you.
Yeah, I will get them muted. Sorry.
Yeah, it's got me going faster and faster, and I'm going
There we
to be
go.
too short actually on all this. Thank
We're
you.
done.
Perfect.
They're done.
The Johnson & Johnson, I think has a huge impact, particularly like I said, getting to areas and tough to get homeless populations. It obviously makes a lot more sense if you can get a team of nurses and medical professionals to go out to some of our homeless encampments and tent areas and just have to do one dose and have a good shot of those people being covered. A lot of the questions that people have is that bright number in the middle of the chart, effectiveness. And obviously it seems concerning when you see 66% effectiveness versus 95 or 94.5 for the other two. This chart comes out of the UT Today. It was in an article with an interview from, I think it's Dr. Mark Sawyer, who's an infectious disease physician at Rady Children's Hospital and was on the 18-member review panel of the FDA that recommended approval of this. And he will tell you, and I've had many other doctors tell you, either of these, if you have the chance to get one of them, we'd take any of them and not pass on Johnson & Johnson to wait for Pfizer and Moderna. The effectiveness number tells you two things, and it means getting sick at all. The Johnson & Johnson and all of them have shown near 100% effectiveness in preventing severe illness and hospitalization. Literally 1 or 2 people in the test, if at all, have had severe, and nobody has died who went through any of the FDA studies of these vaccines. So that effectiveness number, 66%, is saying, yes, you might still get a mild case, but compare that to a flu vaccine is less than that on an every year. And people talk about, well, I still got the flu. You get a much more mild case of the flu than you would have if you got infected with the flu without that vaccination. And that's what the Johnson & Johnson one has shown to do. The technology is different. The Pfizer and Moderna are this newer RNA vaccination system that had been being developed over the last decade or so and really became viable just in advance of this pandemic, and has been a lifesaving in developing it fast. The Johnson & Johnson is more of a traditional, where they take a virus, they make it non-infectious, and then they build a vaccine based around that. So those are your 3 vaccines. Again, if you have the opportunity yourself to get vaccinated, I encourage it. Family and friends, I think it will be a real game changer in beating down this thing. The other issue on the effectiveness there is when the Johnson & Johnson was getting tested, we started getting these mutated strains of the vaccine. You've probably heard about the UK variant, which started popping up around Christmas in England and has spread to California and San Diego. We've had a few dozen here. I think still under 100. There's only 200 cases statewide. The danger of the UK variant, it is more infectious. It seems to have somewhere between 40 and 60% higher likelihood of infecting you. So 5 of us sit in a room for an hour. You know, if before there was a 25% chance of catching the disease, now you're looking at a 35 or 45% chance. It does not show to have worse effects on people. So people who get it, still the majority of them have mild illness, and then there's a percentage that have a severe illness and a percent that it could be deadly. But it is no different than the other versions of the coronavirus. There's a South African variety that we don't know a lot about, as well as a Brazil variety that we're just still waiting to collect data and see how those impact everything. But to the best of our knowledge, all of these vaccines have shown to be as effective against those varieties. The mutations that they've had have not affected the thing that the vaccines were designed to fight against. If you go back to the image of the coronavirus, that ball with the little spikes sticking out of it, that's the crown, the corona. Those are the protein spikes that are used to connect to your cells and get into your cells and get you sick. And all of these viruses replicate those protein spikes and teach your body how to fight off that specific protein spike. That mutation could happen. And it could very well lead to a different version of the virus in future years. But right now, luckily, our vaccines tackle all of those things well. Eligibility. This is a hot topic. I got a text this morning from my mother asking if I could help my aunt who lives in Phoenix to get a vaccine. She's very worried. It's the first I've heard about this. She's very worried and needs to, wants to find out how to get a vaccine. The only chance that she's had is to wait in long lines. And she's been uncomfortable doing that. First off, I told her, my mom, I have a presentation this afternoon that I hadn't finished my slides for yet. So I would get back to her after lunch when I had a little more time. But the vaccine distribution is different in every state, and it's different county to county. As I highlighted, San Diego is doing a phenomenal job in getting information out there and getting vaccinations available to people. More importantly, other places aren't. The answer that I gave my mom and my aunt was checking with your county website and then checking with your local newspaper have been the best resources and ones that I am on constantly, updated for presentations, for meetings, for the rest of it. And so they were happy to go there and check, and I'll follow up and see. Here are our vaccine approvals right now. And again, some counties are different. There's a bunch of states that have, say, people with diabetes are in the priority group, no matter what your age is. That is not the current case now, but is a great idea. People with diabetes have a higher incidence of bad outcomes of this. They're more susceptible to the damage that the disease causes. But right now, for a while there, we've had all healthcare professionals, residents of long-term care facilities. Long-term care facilities, if you know people in them and they've not been vaccinated or the facility hasn't been contacted, let me know. The county has teams of both firefighters and different charities. The Medical Society has our own charity, Champions for Health, that is going around and scheduling appointments at long-term care, senior nursing home, and other related facilities to vaccinate people. We have trained well over 1,000 vaccinators in the county, nursing school students, medical students, dental students. We've trained all these people to be able to go to volunteer and give vaccines. We have staff helping with them. We're doing these clinics literally every day, both the training and the actual vaccinating. We get a supply of vaccine from the county. I took a picture of it. It was like gold. I thought about running off with the refrigerator and retiring, selling all of my Moderna vaccines a few weeks ago. But it's an incredible opportunity to get out there. And frankly, I volunteered at PECO, and my president has gone and volunteered at sites all over the county, all different opportunities. It's an incredibly rewarding experience. So many people who come by PECO, they're in cars driving by, they're thanking you. There's tears coming from their eyes because you're able to take care of their parents or themselves. You've taken away a lot of risk. I have a lot of friends who work in restaurant industry. They just got approved to start getting this. They've obviously been worried. The potential to spread, lots of people around you breathing has been scary. So just this last week, the state and the county has expanded teachers in schools, which is going to be hugely important. Food and agriculture, and emergency service, all emergency service personnel. So it includes our police and others which were not eligible earlier.
Paul, quick interruption.
Yes.
Just because it's
Please.
relevant to a slide before. Erverdos wanted to know, do you have any numbers on the effectiveness of after the first shot for Pfizer or Moderna?
Yeah, I did some research on this just for my personal interest. Israel is reporting after 3 weeks, the Moderna is at 80% effectiveness, and the Pfizer is similar and a little faster, I think. So one dose is incredibly effective. And if you have previously been sick with COVID, it is likely to be one dose is likely to be as effective as the second dose. Yeah, made me feel a little more comfortable to do some outdoor dining after the first few weeks before I got my second dose.
Thank you.
Yes, absolutely. Dealing with this, COVID has not been cheap. I know it's impacted businesses, personal finances, also incredibly expensive to our governments taking care of this. This is, as of this morning, the county is spending $12 million a week on dealing with COVID. Vaccination costs is going up. T3 is their testing and tracing program that used to be much higher. We were doing, who knows how many number of thousands of tests every week. That is starting to go down. As less people feel sick, less of them go get tested, and the rest of the program. Now they're planning to get money from all of these federal. You've seen the federal programs that are passing in the news right now. There's a new stimulus bill coming that has money for counties. This county expects to get 652 out of that new plan, and then some of it goes to the rest of us as well, individuals, those who are suffering, et cetera, but not a cheap plan. I think there's going to be a lot of after effects that we're going to be seeing across our communities, across our government, and the rest. Weirdly, the state has done well with the tax revenue this year. They predicted a huge deficit. So at the beginning of last year, the state had predicted a $5.6 billion surplus going into the 2020-2021 year. Once COVID hit and they did a revision, they turned that around and expected a $20 billion deficit. They passed the budget, they made budget cuts and passed a budget with a much smaller budget. And they're coming out of it with something like a $12 billion surplus. Because what happened, in California particularly, state budget is very dependent on high income earners. They paid the vast majority of state income tax, which is the major driver of state receipts. High income earners mostly maintain their incomes. And so the state has all this extra money. But local governments have been hammered because most of their money comes from sales tax. I live in the city of San Diego. The tourism taxes, TOT, hotel fees, is a major contributor to the city of San Diego's tax revenue. Sales tax is a major driver of most local government revenues. That's why local governments want to have car dealerships in their towns, because that's where they drive up and malls, they drive up big receipts. All of that crashed dramatically, and it's going to hurt the services you're seeing in your local community. And hopefully some of this federal stimulus will offset and compensate for some of that. Oops. I froze up here. Give me a second. There we go. But that drives us to reopening. And everybody's really concerned about reopening, and something we want to see. The state came up with, I think it's reopening metrics and plans last August and September. And then they drove immediately in December and put everybody in a closed down phase as our hospital rates started to skyrocket. We are back to the previous metrics where they have this 4-color system. If you're in purple, that's bad. That means you have widespread disease. This is the snapshot as of last week. Every Tuesday they make the updates. The update has probably happened while we've been on this call. I am sad to say, but the numbers on the left are San Diego's numbers as of this morning. And the percent positivity is a big driver. That's the number of people in tests that have happened in the last 14 days that have positive COVID. That is down. We were having communities that was running 25 and 30% in December. particularly, again, in our poor communities, you were seeing huge numbers. Neighborhood healthcare, anybody who, patients in neighborhood healthcare based in Escondido, they were getting 30% positivity in December and early January with all the tests that they were doing. Countywide, that number is down to 4.2%. And in the poor zip codes, it's at 6%. So good numbers. 4.2% would drop us all the way down to the moderate level. So go from red to purple to red to orange. The 6% still keeps us in red, which would be much more open. At red, indoor restaurants open at 25%. Indoor gyms open up. I think retail goes up to 50% population. Sadly, we have this one dragging indicator, this is case rate, the number of cases per 100,000 people, new cases in the 2-week testing period. And that has been dropping dramatically. It was over 100 during the bad times. It's been steadily dropping, but it's only looking that it's going to be down to 10.8% this week. And so that's what the state recognized, that we're still going to be in purple for at least another week. I am hopeful. That was a number that we were having a hard time with even before the surge started happening in November and December. So I can't promise it's going to get down, but it has been going down so dramatically lately that I am hopeful next week it drops and that we have a much better picture for reopening. And then if people can't maintain safe habits, wearing masks, particularly for those who, and then continuing getting vaccinated, I think we'll continue and improve on that. But and just as an example here, big news hit yesterday. You can tell some what my interest might be. Comic-Con announced that they are canceling Comic-Con yet again this year. So Comic-Con doesn't happen until July, but they put the notice out yesterday that they're not going to be able to have it in person. I've been predicting this for a while and just gaming out where we're at in reopening and getting to some of the bigger things, right? I have to plan my transition gala. We do a meeting every year, the Med Society, and it's we get to honor our president and our incoming president and swear them in, much like you do. And it's a big, it's an important social event for our membership. Families gather and everything else. That would be the first week in June. We realized, all of my guys are going to be vaccinated. They're all doctors, right? But that's still not going to be realistic. Just practically, the county's not going to give us permits to have in-person gatherings of that size, much as something like Comic-Con that brings 100,000 people. So I think all of that time is just a little earlier. Now, as I touched on earlier, at a date that I've been holding hard to, the county plans by the beginning of July to have everybody vaccinated who wants to be vaccinated in their mind. 70% of adults vaccinated by the beginning of July. And they want more, but a lot of people are obviously vaccine hesitant and are going to pass, and that they're right. I think at best in the fall, you're going to start seeing activities like that coming back. Conventions and other meetings and travel of that level. Comic-Con put on the books a small convention in November. And I think that's representative of the work they've done, what they think is realistic of something like that happening. For me, travel has been, my big personal driver for the last 7-8 years. I usually take 2 or 3 big trips a year. Luckily, I was blessed in 2019. I did 3 international trips in 2019. I started the year Christmas in 2018 and New Year's of 2019 in England with a friend. I did a trip to Cuba in March of 2019. And then I went to Oktoberfest for my birthday in September of 2019. So I got to build up my bank a little of some travel and some happiness, but it's been a year and a half now since I've done anything more than a short trip to Sacramento on a plane. And it's something I'm desperately looking forward to and looking forward to getting out of the 20 by 20 room that I sit in for most of the time. Our office closed on, I think March 13th was the last day we were in person in our office. And we decided to permanently close. Our lease was up at the end of the year, and there is no office for the San Diego County Medical Society anymore. We are permanently remote working. It's something we can look at again when everything returns, but it's a lot easier to go find a new lease than sign a 5-year lease and try to get out of it. And right now it's working for us. You know, a lot of my time is interacting with people, but hopefully when this dies down, I get to be in person again at your meeting and the many, many other meetings I go to. School reopening, I think, is the last slide that I have, and then we'll hit any other questions and see where we're at on time. The governor and legislative leaders announced yesterday a $6.6 billion school reopening deal. Now, I'm going to tell you personally here, I don't care your politics, California is way behind on school opening. You guys are better. North County, more of your schools are open or been in person. I know Poway's not North County, but Poway has been open to some extent since October. That is amazing. Much of the rest of the country has been open. Much of California is not. And it is terrible. It is doing incredible damage to our students, to our families, and to our communities. They finally pushed through. I think the threat of a recall on the governor has forced him to take some action on this and came to a deal. The State Teachers Association, which is obviously very influential, signed off and said they like this deal. So the deal has two major components. $2 billion outright for school safety improvements. This is something we should have been able to figure out a year ago. Long supply of PPE, money for testing so that teachers and students or whoever needs to be tested can be tested enough. Ventilation improvements. That's the big deal with this disease. You talk about it, frankly, they still highlight too much washing hands and the rest of it. Yes, wash your hands. Don't let me tell you not to wash your hands. This disease doesn't travel by surfaces. This disease travels as airborne. We didn't know at the beginning, so the washing hands made a lot of sense because that's worked with flu and others. This is an airborne disease. We get it from unventilated areas. I usually have all my windows open in my house, even though I'm alone, except for the noise would be too much for you guys. So there's $2 billion in improvements just for that to go to school. 4.6 of that is to deal with learning loss. And that is an incentivized, and it's contingent here, it's an incentivized program for schools to reopen. Every day after April 1st that they're not open, they lose 1% of that money that they're eligible to get. So this is the carrot part. This is, I guess, the stick part of the governor's plan to say, hey, if you want this extra money, you have to open your doors, and it's paid for different things. They're encouraging them to reschedule, right? Like, why don't school districts take recess now, do your planning, and then open up for an extra month or so in the summer to get kids in the classroom? Or whatever, you know, there's not a strict one answer, but to convince school districts to work on those things and solve these problems to get our teachers, to get our schools open. What this does not do is not reliant on a guarantee of vaccinations, but the state has prioritized teachers for vaccinating. So not only are they eligible now, the state has guaranteed 10% of the supply, and in San Diego, they've guaranteed 20% of the supply for teachers, and by teachers, that's teachers and staff, anybody in the school district, because your janitor and the staff is breathing the same air. They deserve and need to be protected just as much as your teacher does. But to put those out there. Now, it's again, these deals, it's not top down. The governor left it to every school district, and that means negotiating with their various unions to figure those things out. So hopefully this moves the needle. That said, the LA Unified School Teachers Association came out later that day and said they were offended by this deal and it doesn't solve the problem and they're not going to agree to it. Now that might be a negotiating point, but it's concerning and scary. Hopefully, the second largest district in the state is San Diego Unified. I know it doesn't cover up there, but a huge part of our county and our community. Hopefully they'll sit at the table and take something like this. San Diego has said that they will open April 14th. They have spring break in the first week in April, so they'll only lose 5 days, 5% of that, their fraction of that 4.6 billion. But with that, those are my specifics. Please, if you have any more questions or other things that I can answer, you've got some doctors here. Hopefully they've been answering and they can. Luckily, I'm getting positive heads up. I see you, Jay.
Yeah.
If you want to unmute.
Yep. Real quick, I'm sorry. I have two things. So Amy had asked in chat, How long does she need to build up immunity after the second dose of the Moderna?
Officially, you're at full at 2 weeks, and realistically, you're pretty good. The official, yeah.
Yeah, no, go ahead. Go ahead.
No, I was gonna say the official, CDC ruling is 2 weeks. In practice, it's quicker.
Okay. So hang on, Jay, real quick. What I'm gonna do is, because it's actually 1:02, so I'm gonna just officially close the meeting, but that doesn't. People can still stay and ask questions. Okay. So just because there are members who are sticklers for the rules. That's all. It's the only reason I'm doing this. So let me do my quick and dirty words of wisdom, and then Jay, you'll be first on the thing. So here we go. This is my shower thoughts for the week. If someone asks you to spell part backward, don't. It's a trap. So there we go. Jay, go ahead.
Yeah, that was a very nice talk, Paul. Thank you. I have two questions. One, while you were speaking, the Texas governor lifted all the mask mandates. I don't understand why they would do that at this point in time. And two, I got my second shot at UCSD, and the line was like a Disneyland, ride, and there must have been 1,000 people, but I would say 80% of them were under 30. I didn't understand how, I thought it was supposedly 65 and over or 75 and over, and there were just tons. I mean, that's, I guess, medical students and stuff like that, but it seemed like it was a great majority. Do you know why or how that happened?
When you say it at UC San Diego, was that at Petco or was that on campus?
It was on the campus at RE/MAC Arena.
So the RE/MAC Supercenter, that one is focused, I believe, on other populations, like their other health workers and stuff like that. So that does make some sense to me, because they're purposely scheduling in eligible people, but eligible out of their other universes. They let you go schedule it there, but like the public one was more set for seniors and the rest of it. But yeah, there are cases of this where I was at one where I was, because all young people, luckily they were nursing students. So I was like, okay, because I had the same question where I saw a bunch of kids and I was like, oh, they're nursing students, they're going to shoot people. That's good.
And the Texas governor?
That's disconcerting to me. So we've heard the stories and the news, and I don't know how people feel about masks here. Some people are very anti them. I'm pro them. I mean, they're still concerned with spread and keeping it there. Remember, the mask do two things. The first thing of the mask was to keep you from spreading to other people, but it also has an efficacy of protection of yourself, of getting things. But the main thing is, I'm much more aware of it than not. I'm a sprayer, right? I knew it a little before, but I see it now. Every time if I'm speaking loud, I see something flash, and I'm very concerned about people I'm around doing that now. The mask stops that first and foremost, from you putting stuff into the air. But there's a secondary part of it, even if it's not perfectly fitted and surgically fitted, of stopping you catching those aerosolized particles and catching them. And we are nowhere near there is a significant science worry in town that UK variant will send us in another spike, and hopefully our last spike. But there is a significant, once that hit, what it did in the UK is it's what sent up their spike system before the rest of us had one in Christmas. I'm a soccer fan. I travel to go watch soccer matches, and they opened their soccer stadiums in October, and they closed them back down because their numbers just started going out of the roof. And it was because of that variant. They didn't know it then, but they found it was a variant, this mutated variant. We have that, and we can easily hit that spike before we get enough coverage.
Thank you.
Go ahead, Amy.
Amy?
Dr. Paul, I'm Amy Wondolowski, and I have gotten my first vaccine for Moderna at Petco on the 23rd of January. I was scheduled for it again the 19th. They canceled, lack of supply, the 26th and the 28th. Now I'm rescheduled for this Thursday. And I'm a bit apprehensive because our granddaughter is getting married and she's having a garden wedding. And I'm going to be cautious, but I need that second vaccine before the 20th. And if I go the 14th and everything, the 4th and everything goes well, it's just going to put me to the 18th to be 2 weeks. How, if that plan that the supply is not available, what would you suggest my doing?
Well, right now, there does not seem to be any problem with the supply. The supply issues are done, and frankly, we're getting the extra Johnson & Johnson this week that none of the plans were for having. So they're out there to take other, you can't use it, you have to stay with Moderna, but we're getting more into the community for first shots. So you should be fine. Second, I am not a physician. I'm a lobbyist for physicians.
Okay.
I run a society. So my advice is not medical advice. I just want to make sure to say that.
It's from experience.
I mean, first off, you're covered well, and if you get it on that day, you will be very well covered at that point. Again, 80% efficacy after 3 weeks with Moderna is what Israel has shown, and that means 80% of getting ill at all. Your severe illness, you're very, very likely well protected. Still be cautious and careful and get that second vaccine. If for some reason that gets canceled, contact me and we will find you a clinic, because you don't have to just get it at Petco. You can get a second dose from anywhere, and I'll be able to get you somebody to get you your second dose. You can just go meet one of my charity. My charity does Moderna as well. You can go, when they're vaccinating at Shady Acres Senior Home, you can just go meet them there and do it. I have 2 staff members who were sick the day of their second dose, so they didn't go, and they're just gonna pick the day that works and go meet them at whatever facility they're at.
Okay, is there a way to get in touch with you? Is it via the San Diego County CMS?
Yeah, sdcms.org, San Diego County Med Society is our website. You can get to my staff or get to me on there. Our phone numbers are there. Somebody will be picking up. Like I said, we closed the office, but we turned it to a cell phone, and somebody's got that cell phone at least during the work days on.
Thank you so much from the bottom of my heart.
Happy to help. This is what this is a lot of what I've been doing. First, it was like when doctors were eligible and they couldn't get their vaccine, I got a lot of calls to find ways to get vaccine for people. And then it's to volunteer, frankly.
Okay, thank you.
Any other questions today?
Yeah, hey, this is Roy Henderson. Yeah, hey, Paul, I have a question.
Yeah.
There's a doctor that's expressed a prominent opinion, the guy named Dr. Marty McAree. I don't know if you're familiar with what he's been saying. He's saying that he's at Johns Hopkins in Baltimore. He says that the plummeting case rates we're experiencing have been heavily contributed to by 2 other factors besides the vaccines and precautions. And that is that he thinks a lot more people have had the disease than the numbers indicate, because some of these cases could be so minor people don't even notice it, but it does leave them with some immunity against getting the disease. And the other factor is there's a big part of the population, we don't know who it is naturally resistant, either favorable genetics or these buildup of T cells from previous common colds throughout their lives. And those 2 combined with the vaccines, he's predicting that the herd immunity and the case rate is going to be down to the noise level by the end of April. Would you have any comments on that?
I have heard, I don't know him, I've heard both of those issues over the course of the year, and I find both of them somewhat believable. Again, not a scientist. On the first one about other, small cases and others, frankly, I had been meaning to get an antibody test for a while. I wondered if I had gotten exposure early on, was sick around then. I have other friends who are certain they were sick at the beginning. And so I think that that makes a lot of sense to me. And so beyond me, Dr. Christian Reimers is an infectious disease physician at Family Health Centers, one of the big clinic companies down in Barrio Logan. I think one of the best experts in town, and I do a lot of talks with him. And he's talked, you know, a month and a half ago about thinking we were already hitting some herd immunity with the small amount of vaccines we had, but with the people who had already been infected and recovered from it. So that does carry some water with me. And I had heard, and I just don't know enough about, but yeah, the potential immunity based on, like you said, a coronavirus. Half of the common colds are caused by coronaviruses as well. And so if your system had developed the ability to fight something similar, it is very possible. Now, we all know you can get the common cold every year, and because they are different. But
Sure.
if you had been exposed to something that was close enough, it makes a lot of sense that your body had the ability to fight it off.
So what about his prediction that things are going to be pretty good by April? What's your thought on that?
I mean, my only big worry is, and I'm more optimistic than not, is that whether or not this UK variant causes some spike. I don't want to dismiss it. I think we've had it here for a while and it hasn't spiked yet, so I'm even optimistic about that. But yeah, I have some optimism that we're moving fast along this process.
Okay, thanks.
All right, do we have any other questions for Dr. Hegyi? All right, Doctor, an amazing program. It was very informative and very well delivered and very direct, and I appreciate that. I do want to compliment you on your bookshelves. I mean, I'm wondering how much of your medical training came from Stephen King, but it's still a good set of books. Rate my room. Yes, Stephen King gets big thumbs up. Thank you. I hope you will come back again, and we'll have less critical concerns when you come back. It'll just be like, okay, this is the general health of San Diego instead of, are we going to die? So
I hope I can enjoy lunch with you again and get my fancy parking spot.
Yes, absolutely. And we would look forward to that. Bye, Dr. Moyer. And again, Dr. Hegyi, thank you. I keep saying your name wrong. I apologize. But thank you again so very much. A great program.
It was my pleasure. Thank you.
All right, I've got to sign out because I got a dog who needs to be fed. So you all have a great week, and it was good to see you, and can't wait to see you again next week. Bye, Amy.
Take care.
Bye, Roy.